I'm E. coli. I live naturally in your intestines and whatnot. I just found out you're pregnant. Lucky for me, your growing uterus is pressing against your bladder, making blood and lymph drainage impaired, making it easier for me to infect your urinary tract.
I love this show. It's so good.
Yes, it's my favorite.
Oh no.
No.
No. What? Are you serious? No, I'm done. Not watching it anymore. I can't. Can you believe they killed him?
For the watch.
I can't. Robin, I can't.
No, we have to watch the next one. Come on, come on.
Okay, fine. Yeah, let's watch it. Oh, shoot. Pause it. I have to pee again. I'm so sorry. Oh, gosh.
Hurry up, Lauren.
I'm coming.
I thought this
Oh my
whole peeing all
gosh.
the time thing was over.
I thought it was too, but apparently it's not. It's like I always have something like on my shoulders, like it's time to go again.
What do you think's going on?
I'm not sure. I mean, sometimes it hurts, so I'm a little concerned, but it doesn't hurt every time I go. So, I don't know.
Do you think you need to go see your doctor?
I have been a little bit feverish, but I think it might just be because it's summer. I'm sure it's nothing. I'm sure it'll pass. Let's just continue the show.
Okay. Hello.
Hi.
My name is Nicole. I'm a nurse practitioner.
Hi, my name's Lauren. Nice to meet you.
Nice to meet you. What brings you in today?
Okay, so I decided to make an emergency appointment because I have been urinating a lot more recently. And I know that's normal in pregnancy, but I've also been feeling nauseated. And I've also had a lot of lower back pain. And at first I thought it was just changes with my body, weight from the baby. But now I'm starting to get concerned because I'm also having flu-like symptoms. So I'm here to get that checked out. Also, it's really cold in here. Is there any way I can get a blanket?
We can definitely get you a blanket, and I'm sorry you're having such a rough time. How long have these symptoms been going on?
Let me think. I would say about a week or so. I first noticed I was feeling a little hot, feverish, but then I thought it's just summertime. Maybe I'm just overheated or not drinking enough water. But now I think something's really wrong.
Okay, well, let's take a look. I'm going to do a flank test.
Okay. Ow, yeah. Oh,
Oh, I'm sorry that hurts.
it's okay.
I'll take a look at your vital signs. I see you have 100.1 degree Fahrenheit fever. If it was any higher than 100.4, we would have to hospitalize you. Luckily, this isn't the case. It seems to me you probably have a kidney infection. Let's get a urine sample to see what we're dealing with.
Okay, sounds good.
Dilation of the kidneys and ureters, uteral atonia, hypoperistalsis, and progesterone effects all play a part in the development of a urinary tract infection. The presence of bacteria in the urine does not directly lead to low birth weight or prematurity, but the infection can ascend in the urinary tract. Women often have no signs and symptoms of infection early on in disease progression, also called asymptomatic bacteriuria, but this can lead to cystitis and acute pyelonephritis if not treated early, sometimes overnight. Acute pyelonephritis leads to increased risk for premature birth and intrauterine growth restriction.
Okay, so I understand what a clean catch sample is, but usually when I come in for checkups, I do a urine test anyway, but what makes the clean catch different from those?
Sure, well, we need a clean catch sample because it gets the most accurate results possible. The lab is going to look for common bacteria that are the cause of urinary tract infections and also look for other things in your urine that might not usually be there, such as white blood cells, which can indicate infection.
Okay, I understand.
So I won't have your lab results for a couple days. In my professional opinion, you probably have an upper urinary tract infection, with the causative bacteria most often being E. coli. We are going to prescribe antibiotics. Once I receive your results, I will make sure the bacteria identified is sensitive to the antibiotics prescribed. If not, we will need to re-prescribe some antibiotics that will be appropriate to fight the causative bacteria. Since you are not yet past 24 weeks gestation, home antibiotic therapy is appropriate. If you have another urinary tract infection after 24 weeks gestation or your symptoms worsen, I will admit you to the hospital for IV hydration and antibiotic therapy.
Okay, so do I need to do a follow-up, schedule a follow-up, or is it just, here, use my antibiotics, take the prescription?
Well, you'll be getting a shot of antibiotics today and again in 24 hours. And tomorrow I will reassess your symptoms to see if there's any changes. After 48 hours, if you don't have a fever, I will prescribe you oral antibiotics and schedule a 2-week follow-up appointment for another urine culture and reassessment of your symptoms to make sure there's a resolution of your urinary tract infections. So if your symptoms persist after a second dose, another shot of antibiotics will be administered for up to 5 days. For the rest of your pregnancy, we do need to watch out for infection, and we need to get monthly urine cultures until delivery. Antibiotics will need to be continued throughout your pregnancy and 4 to 6 weeks postpartum as a preventative measure.
Okay, thank you so much for explaining all that to me. Something that concerned me is that earlier you mentioned hospitalization. What signs or symptoms do I need to look out for that, or how bad would they get to indicate hospitalization?
That's a good question.
Patients that are less than 24 weeks gestation, relatively healthy, and able to comply with outpatient therapy can be successfully treated at home. Along with being past 24 weeks gestation, patients have a fever greater than 38 degrees Celsius, severe nausea and vomiting, recurrent upper urinary tract infections, signs of sepsis, are immunocompromised, have other significant medical conditions such as diabetes and previous renal disease, have a history of substance abuse, concurrent preterm labor, or an uncertain diagnosis would require admission to the hospital for inpatient antibiotic treatment.
Okay, now that I know all that, what can I do to make sure this doesn't happen again?
Another great question.
Because pregnant women often have asymptomatic urinary tract infections, the best prevention of UTI is proper and regular prenatal visits, in addition to knowing the signs and symptoms of pyelonephritis. Healthcare providers should be encouraged to tell their patients to drink at least 2 quarts of water per day as both the prevention and treatment of urinary tract infections.
Thank you so much for taking the time to explain everything to me. It's going to feel so great to finally get this off my shoulders.
Avoid bladder irritants such as alcohol, caffeine, carbonated drinks. Make regular urination a habit. Wipe from front to back after urination and bowel movements. And most importantly, learn to recognize the signs and symptoms of UTIs to get early treatment. Utilize proper prenatal care and be better protected from UTIs like me.